There's gonna be times in many of our lives when we or loved ones wind up in a hospital or nursing home. What might be less obvious is who's gonna be making the decisions about our care. It won't say it on the sign out front, but these days, chances are increasing that the answer might be private equity. Over the past 2 decades, firms like the Carlyle Group, Cerberus, and Pinta have acquired hundreds of nursing homes and hospitals across the United States. After these acquisitions, frontline aides at nursing homes, the people who turn over the patients, answer call lights, manage behavioral care, saw their hours cut by about 3%. Now, that might not seem like much on paper, but it turns out the results are devastating. The authors, economists including Gupta and Howell, found that private equity ownership can increase patient mortality by up to 11%. Over the study period, that translated to more than 20,000 lives lost. And the kind of care patients receive shifts too. One of the co-authors of that study noted that antipsychotic prescriptions rose 50% in private equity-owned nursing homes, a jump that might reflect not treatment of psychiatric illness, but an effort to manage residents who weren't getting enough human care.
Private equity has had an increasing footprint in the realm of US healthcare, with nearly $1 trillion invested in healthcare deals over the last decade. And as my mutual, Ronan Farrow, I can't believe I'm saying this, states, it has consequential impacts on the healthcare that individuals receive in nursing homes, hospitals, physician practices. And in fact, just today, there was a watchdog group that came out to state that private equity's stake in US healthcare is of a substantial risk to patients. Right? We know from economic studies, as this video mentions, that private equity owned facilities tend to lead to increasing costs and a decline in quality. In fact, a recent study found that patients that go to private equity owned hospital emergency departments are more likely to pass away compared to those that are independent. And the watchdog group, which is known as the Private Equity Stakeholder Project, has urged for more government oversight in these private equity takeovers in a similar way that we would look at mergers and acquisitions. But all of this discussion of the impact of private equity, right, on patient care and patient costs, combined with the urging of the government to have some federal oversight, all of this is really interesting, given the fact that private equity has started to take measures in order to evade government oversight. And this is because just in the last year, several states, including California and Oregon, have passed laws to prevent corporate healthcare investors from encroaching on medical care, which restricts private equity's role in the traditional way that we would think about them acquiring hospitals and physician practices, among other things, which means these private equity firms, in light of this, have to get very creative about how they conduct deals from simply acquiring these healthcare providers. Increasingly, instead of private equity firms buying out hospitals or long-term care facilities or physician practices outright, they are utilizing joint ventures in order to expand their investments. In fact, more than 1/5 of private equity-owned hospitals are operated through these joint ventures, right? A joint venture isn't an acquisition in the way that we would traditionally think about it. It's essentially when two or more independent organizations get together, pool money and resources, and they form a distinct legal entity, and it allows them to share financial risk and expand services. Now, by participating in a joint venture, these private equity companies can evade some of these state laws and be able to engage in deals with healthcare providers. They also, more importantly, can use these joint ventures as a way to make partnerships with hospitals that consider themselves non-for-profit, right? Hospitals that normally would not be able to engage with private equity companies because of their tax status. One specific example that the Watchdog Group points to is a joint venture between LifePoint Health, which is operated and owned by the PE firm Apollo Global Management, with nonprofit systems like Duke Health, Ascension, and Mercy Health. Right? By participating in a joint venture, these companies avoid some of the regulatory and financial risks when converting hospitals and health systems from nonprofits to non-for-profits. So essentially, this is almost a best of both worlds situation for these health systems, as well as the private equity firm, with ultimately patients being the ones, according to the research, that are harmed by this. Now, there are several state and federal and nonprofit groups looking into this and urging the federal government to update tax status and federal law in order to correct for this loophole. But for right now, it is a big problem in healthcare that a lot of people who study private equity are looking into. For now, that's all I got. As always, if you have any questions, let me know.